Director of Ceremonies, Honourable Dr. Badaya Moyo, Minister of Health and Child Care, Zimbabwe. Honourable Comrade Richard Moyo, Minister of State for Provincial Affairs, Matabele North Province. Honourable Sarah Opendi, Minister of State, Health, Gender, Community and Development, Elderly and Children of the United Republic of Tanzania, Karibuni. Then Professor Yoswa Abishia, the Director General of ECSA. Professor Jean-Marie, World Health Organization representative, country delegations, development partners, Zimbabwe senior government officials, ECSA Secretariat, media here present, ladies and gentlemen, comrades and friends. It is with great pleasure and honor to welcome you all to Victoria Falls in Zimbabwe during the occasion of your 7th East, Central and Southern Africa Health Ministers Conference. The people and government of Zimbabwe are privileged that you chose our country as the host for the annual interaction. Especially honored is your choice to hold this meeting at this spectacular heritage site, the great Muswatunya. I hope the facilities we have put at your disposal are of acceptable standard and indeed suitable for the purpose. The theme of this conference, and I quote, is universal health coverage. That is addressing the health needs of the underserved or undeserved, unquote. It is not only apt but resonates with the desire to universal access to health care. As leaders in our different stations, we are obliged to come up with initiatives that ensures people have access to affordable and appropriate and quality health care. We are therefore gathered here to take stock of the progress toward achieving sustainable goals to which we are all committed. Within the SDGs, we have all again committed to universal health coverage. Whilst we strive for economic development, it is imperative to us to note that social development is unachievable without the access to affordable, appropriate, and quality health care. Ladies and gentlemen, Zimbabwe's journey in the quest for universal health coverage in the face of challenges offer nuggets of insight from which we can all draw lessons. This is not to imply that we have arrived as a nation, but simply to acknowledge the great work in progress. Firstly, as far back as 1999, we set up a fund, the National AIDS Trust Fund, dedicated to fight against HIV/AIDS. And this fund is resourced from domestic resources. Secondly, Zimbabwe has had a prepaid health insurance for the formerly employed workers since the early 1980s. With a significant number of our people now employed in the informal sector, Zimbabwe is at the verge of introducing a law to compel this sector to provide health insurance for its workers. This will be achieved through innovatively crafted packages. Further, a national health insurance for the indigent is being put in place. Ladies and gentlemen, Government has also set up a health levy based on 5% tax on mobile airtime and data coverage. Through this initiative, government realizes close to $4 million, United States dollars monthly. We have used this to make blood and dialysis services free to our citizens, as well as improve on medicines availability in our public institutions. Our health services take the primary health care approach, and we are strengthening this approach by further decentralizing from rural health care centers to village health posts, which offers a suitable package of services supported by higher levels of care in the system. This is an attempt to bring the delivery of health service close to the citizens of this country. In order to enhance the credibility and the bankability of the health delivery system, we are now generating evidence from institutionalized national health accounts, as well as the national AIDS spending and assessments, so as to justify resources requirements from Treasury. Because you don't just have to go to Treasury to start justifying why you need it. That 15% you always demand, you need to justify it. You need to justify it. We are confident these and other approaches to financing healthcare will help us move towards transitioning from over-reliance on donor support to a largely domestic-based resourcing for effective universal health coverage in the country. The agenda before you is to address the challenges we face as a region. As your leaders, or as your leadership, we expect that you put your shoulders on the wheel and work to come out with initiatives which will seek further health services in our region, which will seek better health services in our region. As we remain mindful that we are part of the global village, we must also be cognizant of the fact that our primary efforts remain focused on our region, our states, our villages, and our households. Those are the points where we want to achieve the greatest positive health impacts for our people. Our policies and our strategies in health must all be pointed towards achieving universal health coverage. Wealth follows a health nation. Ladies and gentlemen, yours is a task that must be accomplished without fail. That is what we expect of you. People expect the best from you. I urge that in between your deliberations, you may take time. That is on a lighter note. You may take time to relax as you enjoy the Victoria Falls, a natural wonder, better referred in our Tonga and Nambia languages as Muswatunya, meaning the smoke that thunders. I don't know whether this is after Tonga and Nambia. I think those from Lesotho must assist me. Huh? Because it's either Sesotho or Slozi. Muswatunya. Huh? Or Tswana. This is the smoke that thunders. Huh? So thank you very much for assisting me and for correcting my officials that it is Tonga or Nambia. Be that as it may, the name is Muswatunya. Colloquially discovered by Livingstone. I don't know how he discovered something that was already existing and something that he was actually shown or taken there by the people who said, this is what we have. And then he says, Musua too, yeah. And because he thought he had discovered it, he named it after his queen, Queen Victoria by the time. And it was now called Queen Victoria's Falls, or Victoria Falls. You see, we should have called it maybe by another Tswana name, or what is these Lozi kids? Is it Luanika? The Wanika, because the Wanikas, they speak Sotho. They speak Sotho. The western part of Zambia. Huh? Is it true? Indeed, eh? The Wanikas. They speak a language that is a dialect of Sotho. They are the ones that came with the word Muswatu. So I encourage you to take your time to experience this one. See the falls in an early morning walk and be refreshed by its showers in the rainforest. See the animals, ride the Zambezi, and you will definitely be refreshed. You will definitely be refreshed. Because when you start your day, you'll be refreshed. I'm sure from this, you are going to go down there, get those wonderful showers, and then when you come back, you'll be refreshed. The Victoria Falls belongs to the two of us. Huh? Zambia and Zimbabwe. Huh? We were once one under the Federation of Rhodesia and Nyasaland. Rhodesians, not Rhodesia, Rhodesians and Nyasaland. Because we were Southern Rhodesia. Zambia was Northern Rhodesia. And then Malawi was Nyasaland. And we became a federation in 1953. And that prompted our liberation struggle. And I don't know whether it's unfortunately or fortunately, Zambia was renamed Zambia. Northern Rhodesia was named Zambia. And we were renamed Zimbabwe. So in the alphabet, we are the last one. In any given conference, as it is here. If you see Zambia, know that the next one is Zimbabwe. So that's what it is. So we share this before, but we always have a problem with South Africans. Where are South Africans? Huh? They don't want to show themselves now. I'm not going to say anything untoward. I'm going to say something very complimentary. They advertise and say, come to South Africa and see Victoria Falls. My minister said it doesn't really matter as long as we share the Zimbabwe shares the spoils. And Zambia says, come to Zambia and see the falls. But they don't have the falls, they have the back of the falls. So where are the falls? They're in Zimbabwe. Am I wrong? Okay. So you come to Zimbabwe and see the falls. It's one of the 7 wonders of the world. We are very grateful that you are here. And it was actually heartening to hear that you were coming here. Is it the second time or the third time?
To Victoria Falls for the second time, to Zimbabwe for the first time.
Victoria Falls the second time. I think you are missing also. You need to go to the Great Zimbabwe. The Great Zimbabwe, who is from where this name Zimbabwe comes from. It was a kingdom, a city that was built in about between what? 700 and 1,000 years back, by one of our emperors who used to run this part of the world up to Beira. And sometimes we politicians say, we can't say we are landlocked. Why don't we try to get back our land in Beira? And someone then reminds us, says, no, we need to recognize the colonial boundaries. And then we say, who were the colonialists? And we told them that we did not have a seafront. So those are some of the arguments that we have. But definitely enjoy yourself. I said, yeah, I don't know with the suit. Hold on. Okay. I know them. Hold on with that. Right. Do we have anybody from Botswana?
Yeah.
Yes.
Kima.
President
Emela Huwa.
of the college's master.
Uchogo guy was that? Mau. Okay. Okay. Belanda ke miro ke mulodo la phala mjana makausi la. Ramongo adila manati. La kuria go yalani na mane etwa ihumana. No, forget about what I'm saying. It doesn't mean anything. I just want you to laugh a little bit. You've been subjected to a lot of serious addresses here, especially by the Director General. I could see all of you beginning to say, is this thing really worth it? Or we should then pack our bags and go. Okay, be that as it may. It is now my singular honor and privilege to declare the East, Central, and Southern Africa Health Ministers Conference officially opened. Kembo Mohadi. Asante sana. Kitu mesi. Realmente.